Alright, so thank you for joining us here again today. I'm going to be going over some palpations of the head and facial structures for any suspected injuries that may occur. You'll want to begin by palpating the frontal bone of the skull, so this is the forehead region. You'll palpate for any discontinuity in the bones. You can palpate the rest of the skull going posterior, feeling on their scalp, and then back of their head. And then you'll want to move down into the orbital margin, so that's the area making a circle around the eye. You can palpate for any tenderness, palpate on the eyelid pretty gently. And as you go around, this is the zygoma area, so right above the zygomatic arch or their cheekbone. So you can palpate on that to see if that has good continuity along the bone there. You'll do this on both sides, palpating the orbital margin and on the eyelid. And then you can palpate the nasal bone, so that's at the most superior aspect of the nose. And as you palpate posterior, or inferior, you'll run into the nasal cartilage. So there is no bone at the end of the nose. That's the cartilage. You'll want to make sure that lines up with the indent in the top lip. And then you can palpate the TMJ. So this is the temporomandibular joint. So that's right where, right beneath their ears on their chin. You can palpate there. You can ask them to open their mouth. You can feel that move, and they can close it. And then you can palpate the mandible as you come to the chin, or you can start at the chin and palpate outwards. And then we have the periocular area, so this is right below the ears, kind of where that TMJ was, but you'll just palpate around there for any point tenderness. And you can palpate the external ear, so palpating here. It'll be pretty obvious during inspection if they have any ear injuries, but you can just palpate to check for that. And then, let's see, word up. I think we can do the teeth as well. So you could put on gloves and palpate their teeth, but another easy way to check the integrity of their tooth is to ask the patient to apply pressure with their tongue to the suspected tooth that may have been loose. So if they can push on it and you can see it move, then there's obviously some problem with their teeth going on. And then we can also palpate, getting into the neck a little bit, the hyoid bone, and then the cricoid and thyroid cartilage right beneath those. But that's getting into the neck. So we've done pretty much everything for the bony structures of the face. We can do some of the soft tissue. So the temporalis muscle, so this is at their temples on the side of their head. You can palpate there. You have the masseter muscle, which is for chewing. So you can, that's going to run here vertical. So you can ask them to clench their teeth, and this muscle will become prominent on the side of the cheek. And then the buccinator muscle is also another mastication muscle. So when they're clenching their teeth, this one runs horizontal from the corner of the lips, and it runs into that masseter muscle, so you can just palpate there as well. And that about covers the bony structures and soft tissue palpations for the head and face. So that would be it.